can only end it as one people, one vision, one mission. We can only end it as one people, one vision, one mission. Yeah, yeah. HIV and AIDS is a shadow of death, a shadow lurking in the dark, coming after adolescents and youth.
Hello everyone, my name is Tekla Adjota, the Northern Regional Facilitator for Young People's Network on Sexual Reproductive Health, HIV and AIDS. We are so excited to be at this year's 2023 ICASA running under the theme, AIDS is not over, addressing inequalities, accelerate innovation and inclusion. Yesterday was our first day and we're so excited about everyone who came to our stand. They wanted to know who we are, what we do, and some of them even offered us opportunity to work with us, which is a great opportunity. Talking about the Youth Pre-Conference, it was perfect, it was youthful and youth were included, and it also reminded us that as young people, as youth, we still have a long way to go. Today's expectations are not less than yesterday's. We are still expecting to see more young people's participation, more inclusion of young people, and having more opportunities to see how young people can be included. We are so excited to be at ICASA 2023. Thank you.
We can only end it as one people, one vision, one mission. Yeah, yeah. We need to work together and to unite and bring people together to eliminate human immune virus acquired immune deficiency syndrome. We can end it as bridge the gap. Let's fill the void. Let's educate and empower the youth. Let us fight discrimination.
PEPFAR's been around for 20 years. I'm sure many of you are aware of some of the work that PEPFAR has done to respond to the needs of young men and women, adolescents across sub-Saharan Africa, including the DREAMS program. You know, one of the insights from the DREAMS program, I think we've invested $800 million over 8 years into that program, is that we need to do more to empower youth voices and to ensure that our programs are co-designed and co-led by youth. And so under Ambassador Nkengason's leadership, I think there are several things that I want to reflect to you in answer to your question, Joyce.
But I want to talk a little bit about UNAIDS because we are a little bit different. For one, we have civil society on our board. We're the only UN agency that has civil society on our board, and often that includes young people. And again, here is an entry point for all of you to advocate and make sure whoever sits there on behalf of communities that they also include young people's voices and invite young people in, because we have that opportunity for you to come and speak at our board and so forth. So I think there is an entry point there. You know, yes, we have a global strategy, but also, and that's really important, we have a political declaration from 2 years ago. And that political declaration for the first time talks about GPER, the greater involvement of people living with HIV, and it specifically names key populations and adolescents and young people. And again, that's a commitment, it's an international commitment that member states have signed up to. So in the work that you do with parliamentarians in your own countries, but also with us at the UN, with PEPFAR, that's an advocacy tool you can hold up and say, but you committed to this, and where are you, and where are the entry points for us to speak and to be heard.
Okay, thank you. After Tanzania has been one of the most vibrant networks in Africa, but also in Tanzania. And through our engagement with UNFPA,
move our advocacy in an understandable way in the eyes of the donors. So the other thing that happened was the support of our social country coordinating mechanism, which is the LCCM, especially the secretary who was very much there in our consultation meetings to unpack the development processes and the modular framework so that at least the goals can recommend on things they understand.
That nothing comes from France and nothing ever could. Those born beneath an angry star can't imagine how fragile we are. And on the rain will fall like tears from the stars, like tears from the stars. On and on, the rain will say how fragile we are, how fragile we are. Oh, on and on, the rain will fall like tears from the stars, like tears from the stars. Oh, on and on, the rain will say how fragile we are, how fragile we are. Oh, Zumba's in the bobbin, this in the bed, in the bobbin, sitting down.
Good evening. My name is Raymond Yeke. I'm sure most of you around the room know me. At least I can safely say I know almost everyone in the room. I'm with the National AIDS Council. And my part is really not to give a speech, but just to welcome you to Zimbabwe on behalf of the National AIDS Council and the Ministry of Health. This event has been organized in partnership with SSLN, and the crowd here is generally the crowd that has interacted in some of our SSLN sessions, either virtually or physically.
Thank you for joining us again for another small event. I know that ICASA has been quite an experience with many different learnings and many different opportunities, and we just wanted to have the opportunity ourselves to provide you with a space to basically get to talk, mingle, and enjoy yourself. So from me and from the entire SSLN team, welcome and thank you so much for joining. Bye.
Sex Workers Alliance. I am a sex worker. I am also outgoing advocacy fellow Kenya 2022-2023. I was leading a project for sex workers who use drugs at the coastal region of Kenya. I am here as a representation of a young sex worker. I am a representation of the stigma that we go through as young sex workers. And I think what I'm going to say right now is that we young people, we are the experts in the issues that are affecting us. So I'm just going to call on everyone to stop sitting in fancy hotels, fancy boardrooms, and discuss youth-related issues without the presence of the youth in the room. So in terms of youth financing, I will agree with my colleagues that we are the experts. We are capable of leading. And I think my takeaway will be from my experience here at ICASA. As a young sex worker from the coast, I am actually the only young sex worker from the coastal region of Kenya present here today at ICASA. And I think youth financing starts by providing avenues for youth to be engaged. Like, where were the scholarships? Why don't we have so many youth here?
What's making it difficult for youth-led organizations to provide the donors themselves. So I've been moving around here, speaking with some of the donors here, and they actually say that you have to have 5 years experience, this and that, to receive funding from us. And these processes are actually long and difficult for youth-led organizations to be able to get funding from donors. So we need to make the process easier for youth-led organizations at grassroots level to be able to get funding so that they can be able to lead the community level.
I think this was part of my very first remarks which I gave. And one of the things that I said was how if the donors, now I speak to the donors, right? Because they're the one who was saying like young people are not capable, right? Like you need to have 5 years experience and so and so. So if you see a very good project. A very good youth, young people who are like very clear, very focused on what they do. Why don't you, now speaking to the government partners, why don't you strengthen that particular organization? Starting with the staff, starting with the financial capabilities, for you to actually be able to finance that particular organization.
So firstly, you don't expect a young person or a youth-led organization to have 10 years of experience. And we see that every time there is a post for a youth officer somewhere, and there's 5 years experience, and you wonder, what kind of young person has 5 years experience? So what we need is, when we want to fund youth work, we need to see the needs of youth-led organizations. So number one, they might not have all the policies that the bigger organizations already have. So our funding mechanism, they should be able to say, what are we putting in terms of capacity strengthening?
Adolescents and youth, they are at risk due to lack of education and access to care. Ignorance and stigma is causing a rift, leading every day to new infections and despair. Drug and substance abuse.
For your question, just to add on this, in the MSF cohorts where we can actually collect data, the mortality in hospital despite treatment is still high. It's 20 to 25%. After treatment, so the mortality of untreated advanced HIV with opportunistic infections is much higher, and it will depend on setting. Evolution of viral load, just to add on that, one of the things we need to consider, most of our patients in most cohorts with advanced HIV are people who disengage from care. So one of the things we need to consider is treatment switch if necessary. Where available, we need to understand HIV resistance. So that's also a topic. Broader topic, but that's also something to be considered in advanced HIV. Thank you.
Okay, thank you. My name is Diliosa Mukado with the logistics based in Zimbabwe. So I have some supply chain issues that we have here in Zimbabwe, like for example, I don't know what other countries are doing, because for HD are supposed to be having those 3 commodities at the facility at the same time, and most of this testing is happening at the lowest level. So I don't know if any other countries, maybe from the experience, in terms of maybe packaging, to have a single combo kit where all the 3 tests can be available, especially for the lower level, where we might be using the rapid kits. So I also want experience from other countries. Then another issue is on the Presto, where we initially had the BD funds calibers and funds counts, which were located at the central level and provincial level. And the coming in of the Presto, we had to replace the caliber and count with Presto. Now come July 2024, Presto is being discontinued. Obviously from district level we have the Patek, and the lower level we are also using Visitate. So I just need countries' experience to say what is going to happen from July 2024 onwards for those higher level facilities which we are using Presto. Because like now it seems like I personally, I don't have options. So I just need experiences from other countries. Thank you.
We have asked the Global Fund, since they have made CD4 testing both at baseline and re-entry into care a program essential, which we welcome, to go a bit further and give an indication to countries what their quantities of CD4 should look like, based on profile of disease, based on how many people are on ARVs, based on retention rates. We need that tool, and try, if you've already made it, bring it on. That is the immediate need. We need to get Abbott to pick up their broken machines that have not been serviced, whether because the service and maintenance charges were too high or because they were negligent. Pick them up. We know that there are 2,000 in the region. Pick them up, fix them for free. And then thirdly, we need to look towards the future. If PIMA is it, we need to find another manufacturer. We need technology transfer. We need Africa CDC leadership. Help us find a manufacturer. Help us optimize that test so it can last longer than 10 years. Or find a better test. But we need a solution. And we need to cook it up. In 1 year, 2 years, 3 years. Otherwise, all of the work of the Fight AIDS Coalition and increasing demand for CD4 and fighting and making CD4 part of the PEPFAR COP, the NSPs, the national guidelines, and the Global Fund proposals, they have worked so bloody hard. They've done their job. What about us doing ours?
There's someone else from PEPFAR, someone else from Global, from UNAIDS, from WHO, anybody, anyone who's collecting data, here is a call for action. If you have access to the data, we are asking, because we can't advocate for something in the dark. The numbers must come out. Is it children? If we know that it's children, 30%, good, we now know. How many of the key populations are dying of AHT? In which country? Which key populations? If it's women, which women? Is it adolescent young girls? So that we have to get to that level as part of the roadmap to end AIDS by 2030. So I think we need to try and do better so that in the next conference, no more AHT workshops, no more AHT sessions. We must talk about how did we get to zero. So all of us, some commitment, and I know it's easy to say this than do it because we know that we are living in a scarce resource environment, more pressure on those who are providing resources to provide more, but also more pressure on communities to continue to support and hold communities and support people in the journey of care and remaining in care. With those words, thank you so much for being an amazing, awesome audience. See you in 2030 with zero AHTs.
Thank you, Dr. Landry, for moderating this session for young people. And with the number of people in the room, it shows that delegates at ICASA 2023 are interested in programs for the adolescents and young people. So YPNSRHHA is Nigeria's version of the U-Test. U-Test started in Côte d'Ivoire, but when we were about to implement in Nigeria, we wanted something that the young people, the adolescents and young people in Nigeria can actually easily relate to. So we decided to come up with the name YPNSRHHA, which means Youthful, Alive and Healthy. Youthful, Alive and Healthy Nigeria. YPNSRHHA was created for young people as a digital first HIV prevention model for adolescents and young people, targeting two prevention options. The two prevention options are HIV self-test and also for PrEP. It's the flagship model for Nigeria, and we came up with a model that people can actually test, do the risk assessment, and from there continue till they are linked to a facility.
Cause AIDS is not over, it's not over. Cause AIDS is not over, we can only end it as one people, one vision, one.
Thank you very much. Like it has been said by the moderator, my name is Happened Nyani. I come with the People's Matrix, which is basically sitting here with the regional Sapiens Young. And so what I will be speaking to is connecting the dots, between youth organizing when we talk about the various issues that youth are organizing for, and how do we sustain and strengthen that connective and collective youth movement and advocacy, and how do we sustain the movement and our agency. Next slide, please. So I'm going to be talking to the young people in the room and those that work with young people. Often it is said that young people are troublesome, young people are disruptive, young people are not competent enough. And these are the reasons why we are not being trusted to lead our own issues. And so ours as young people in our advocacy, in our organizing, is to break the fallacy, to break the rhetoric that we are not enough for ourselves to lead for ourselves and solve our own issues.
One thing many of us can agree to is that digital health is really bridging the gap in making sure that sexual and reproductive health services are being accessed by young people. So with that in mind, we need to harness the power of the multi-dimension of digital health and addressing sexual and reproductive health, in making sure that young people are able to access services, and we're able to formulate policies, and make sure that we have a healthy population. Can we move to the next slide? So in order for us to really harness the digital dimension of, to harness the power of the multi-dimension of digital health, we need to keep in mind of the guidance or the instruments that guide how digital health tools and systems should look like. So those are some of the examples that we have. For example, at global level, we have the WHO Global Strategy on Digital Health. Tapuzo actually spoke about it and how the Mobile Summit actually speaks to it. We also have the UN Digital Health Strategy and the African Union Digital Health Vision. So all these provide a basis to what or how digital health systems and tools should actually speak to. They should be able to promote data exchange, data privacy, and should be able to also provide systems that make health services become very easy.
Structures in sexual and reproductive health policy making. We talk a lot about how adolescents and young people are highly affected by most of the issues we are addressing today. However, if you go back to our specific countries, we still are lacking national platforms that can bring together the voices of these young people and coordinate them to facilitate an environment where they can fully engage. Additionally, from my observation and experience being a young person, as I am graduating as well, I've noticed there is an issue around having sporadic engagement, where young people are only engaged at the very beginning of processes, and as processes get to higher level, the likely you will find less numbers of young people engaged, if lucky. For us to be able to have an ideal engagement for young people, we want to be sure that it's consistent and progressive, meaning young people are able to engage at all levels, including community level as well as high levels. We also have limited capacity of young people to enable meaningful engagement. With that I mean, it's one thing to invite a young person in a room and have them sit. It's another thing to have them invited in a room and have them speak. But also it's very important, and I think this is an element that we normally forget, to get them to understand exactly what is happening in the rooms. We have a lot of young people, we have a lot of young people going into these spaces not understanding what exactly is going on. And this could limit the power of the solutions that we actually propose. And it's also important how we translate the information, perspectives, and opinions of young people into action after they engage. So we're moving from having young people invited in the rooms for checking boxes, and how we have young people participating to check boxes. Because the room will not even provide the space for them to seek clarity prior to engaging, to making sure that they can meaningfully contribute to discussions going on. Unfortunately, this has left us a lot of adolescents and young people, specifically adolescent girls and young women, due to limited access to smartphones, but also limitations with data affordability. Last but not least, it's around financial resources. We understand how in our countries we have different geographical locations, and most times most policy discussions will happen in cities away from our home cities. For young people to engage will require transportation, but also like being able to afford accommodation, and this can be a barrier for most of young people to attend.
that the needs of particular pregnant people are noted in comprehensive abortion care guidelines. For example, given the high prevalence of HIV in the regions, the needs of pregnant people living with HIV, for information and options both concerning safe pregnancies and safe conception, we may say, and safe abortion should be considered in devising policy and implementing services, and the needs of young people in relation to abortion, including privacy, non-coerced decision-making, particularly in relation to parents and non-judgmental service provision should be considered. So I'll leave it there as just an indication of the importance of the integration of these issues.
A deadly game that we abuse, leading to HIV and AIDS, a silent threat, a consequence we cannot forget. We know that in it no way could it be button, cause AIDS is not over, it's not over. Minana we say bambane sitandane, cause AIDS is not over. We can only end it as one people, one vision, one mission. We can only end it as one people, one vision, one mission. We need to work together to unite and bring people together to eliminate human immune virus acquired immune deficiency syndrome.
Young persons and key populations, the rate of infection continues to rise. We do have gaps, and we need to make sure that we address them. We also know that young people with poor access to HIV and AIDS services, they have poor adherence, and this might also lead to virological failure. And also, we are also worried about the high rates of depression, anxiety, and suicide ideation amongst the young people. We need, therefore, to make sure that we treat our young people and provide them with a full life and make them happy too. And as we continue with our treatment strategies, we need to make sure that we integrate HIV and mental health, and drawing on experiences that we have gathered amongst young people. We know that in Africa we don't have much resources, but I can tell you that we are very rich in resources when it comes to community heart.
Next slide. So why does psychological treatment support adherence? Well, because it addresses the primary drivers that we know from a huge amount of research. We know that undermines being able to take your pills consistently every day. And these are things like delayed or incomplete disclosure to the young person, the confusion and disempowerment that accompanies having limited knowledge about HIV, and poor mental health. And psychological treatment is an integral part of psychosocial support. What it does is it provides a reliable, trusted space to talk, to be listened to, and be counseled. And the support is person-centered and fosters connectedness. And in being heard and understood, people are no longer alone. And in being supported, they have a strong understanding of HIV. They appreciate that their HIV status does not need to determine their future, and they can thrive. And it is inviting young people to share in the experience of health, hope, and happiness. Next slide. So, to enable and sustain viral suppression in this population, we should be thinking about treatment plus. Obviously, the first line of defense is ART, but to convert efficacy to effectiveness, it needs to be accompanied by psychological treatment. Next slide. So it's worth just taking a moment to ask whether we still need mental health support given how good ART is getting. Dolutegravir reduces the need for treatment to be taken all of the time. but it still needs to be taken some of the time. If someone is struggling with their mental health and doesn't take their treatment, then the effect of the treatment, HIV treatment, becomes fragile too. So there's nowhere to go. We cannot ignore mental health and well-being. And there is an increasing policy emphasis to biomedicalize each aspect of the HIV response. But we don't need a wonder drug for mental health. We have a more affordable, a scalable, and effective and appropriate solution that works. And there are a number of models doing this, but I'm going to talk about Jandiri, an exemplary model.
But we can all agree in terms of the statistics that have been shared even over the course of the week, that the HIV prevalence rate and also infection rates are very alarming, especially when looking at women who are diversities, but more particularly for young women in sub-Saharan Africa, where we are seeing each week we are continuously being infected by HIV. So what are some of the challenges that we can look at? And we can all agree that in the last decade, especially in sub-Saharan Africa, we have made and seen a lot of progressive lawmaking, some different policies that have put in place, different guidelines in terms of how we can combat HIV. But the problem has always been in implementing these laws, in practicing these laws, and how they can really matter for women, girls, and gender diverse communities.
On top of that, ICASA gives 200 at scholarship in person. And we give 1,571 scholarship. This year, we give a total of 1,771 scholarship. In terms of program, for the 5 days, we organized 182 sessions with 546 speakers coming from around the world. We even have speakers Pakistan here, for Pakistan here. And we run also 27 sessions at the community village alongside with the 9 community network zones. Once again, as I said, without participants, without delegates, there is no ICASA. I just want that you should give yourself one round of applause because you have been wonderful. Thank you.
I expected that next time when this will happen in Zimbabwe, I'll be here also. Thank you very, very much. I hope you of your beloved ones every day. merciless wings to communities. I don't care who you are, where you live, rich or poor, black or white, child or adult, I am TB. I am everywhere, almost like the air I breathe. Millions lie on meds today from illnesses, and yet you guys can actually defeat me. Prolonged cough, chest pains, fatigue, weight loss, fever, night sweats. That's how you can identify me. When that happens, you must rush for TB screening. As my coughing, my sneezing, my spitting may easily have spread to you through the air, I am TB. For I speak like Usain Bolt. Minus, you can't escape my blood unless you have good ventilation. People living with HIV, my name is TB. I attack because your immune system is already compromised. Children under the age of 5, I am also after you, as I am after everyone else. If you are exposed to my teeth that never fail, my teeth that never miss, take TB therapy, TB preventive therapy. When caring for those that I have put to misery, wear a mask. Because I am TB, I attack especially the careless. When I spread my infectious fangs, you too can fight me by spreading infectious words with friends, with family, with neighbors, with peers, warning them of my vicious attacks. And how you can break my wings that never fail. I am TB. If your governments commit funds to fight me, if your leaders commit more finances for treatment and research, you may win me over. But I'm no pushover. I am TB. I am merciless. I attack. Merci beaucoup.
The President of the Republic of Zimbabwe for really embracing us, pushing us, encouraging us, and supporting us. And this government will have given us the protocol, security, transport, this venue, and other things that make a conference successful.
We are here at ICASA 2023 conference with young people that were supported by UNFPA Zimbabwe as well as National AIDS Council. So they are going to share with us their experiences during the conference and key takeaways. So without wasting much of your time, stay tuned and listen to what they are going to say.
My name is Panashe Mingo from Chirezi district, representing young people in business. What I loved about the ICASA 2023 conference is on the session we had on innovations, technologies, which are being implemented by researchers and scientists in trying to prevent and treat HIV and AIDS.
I'm Charlene Mawere from Harare, Young People in Business. I was happy to attend ICASA 2023 because I learned on how different organizations are working on reducing HIV and ending AIDS by 2030. Thank you.
Greetings, my name is Tafara Lewadi Magidi. I represent our youth in disability at national level, and my key takeaway, which I took from the national ICASA, is including the person with disability in their advocacy and mapping whenever planning things that consider their health and well-being. Thank you.
Hello everyone, how are you? My name is Tapila Wilson from Bulawayo Province, representing the young people in their diversities. So my key takeaway for this ICASA was that we want to end HIV, and as youth, we need it, we can curb this. Together, united, we can end the HIV. Thank you.
Hi everyone, I'm Namatemba Mpofu, representing the youth in faith-based organizations. What I loved most about the ICASA conference was a statement by Susan Hillis that said, when we decrease the number of new infections in men, we will decrease the number of new infections in women by half. Thank you.
Hi everyone, my name is Panashe Chikweche.
representing youth in arts. So my key takeaway at the ICASA 2023 was that AIDS is not over. AIDS still exists, but it can be overcome. So one of the main things that I learned was that the donors are willing to support our youth-led programs based on our community needs. So that means we'll be able to achieve our goal of ending AIDS by 2030 in an effective way. Thank you.
My name is Tekla Tsatsi, the Northern Regional Facilitator for Young People's Network on Social Reproductive Health, HIV and AIDS. My key takeaway is that I should not underestimate the power that I have as a young person to coordinate, plan for an HIV-free generation in the near future. Thank you.
Hi there, my name is Shidadi Francisca Mbazo and I represent young people with disabilities in the Young People's Network on Sexual Reproductive Health, HIV and AIDS. So I had the honor to attend ICASA, and one of the key takeaways that I got was that in Zimbabwe, there is 78% reduction in new HIV cases, which is actually the highest decline in the Eastern and Southern African region. And also that Zimbabwe managed to beat the 95 global target 3 years ahead of the deadline. And also I also took away the fact that young people should be the ones who are at the forefront in this fight to end AIDS by 2030.
Hello everyone, my name is Belisma Ponte from Mashonale Central. I represent young people in resettlement and rural areas. My key takeaway from ICASA is the importance of taking statistics and including research in our work as young people so that donors and the government can take our work seriously, and we can also have evidence of the work that we are doing. Thank you.
Hello everyone, Makumana Mebi Merlin is my name. I'm a provincial facilitator for Manicaland Young People's Network on Sexual Reproductive Health, HIV and AIDS, and it was my privilege to attend ICASA 2023. And one key takeaway I have is that as a young person or as young people, we were given a button stick so that we can end AIDS, and we have to even educate and empower other young people in different communities.
My name is Agnes Kamchikariwa, representing youth in fishing camps. From ICASA 2023, I had an opportunity to network with other young people from different countries, and I had also an opportunity to learn and adopt the new intervention they are doing from their various organizations on how best we can reduce new HIV infections in our country amongst the youth. Thank you.
Hello, my name is Tinashe Banda, representing youth in tertiary institutions. During ICASA 2023, I got to experience the power of networking, and with confidence, I can say that after this, I'm not going to be the same again. During the conference, I also got to experience that if young people are given opportunities to speak up and also to represent their constitution, they can deliver.
Hi, my name is Dr. Mukua Tanaka from Mutare Rural. My key takeaways from this conference is that we need young people, as young people, we are the change, and we need to be empowered to end HIV and AIDS by 2030. Thank you.
My name is Tanyara Zwakei Vinyo. I would like to, I'm excited to attend the ICASA 2023. This gives me a platform to learn evidence-based information in terms of the research and innovative ideas on how best we can improve treatment care and support of young people, and also ensuring that if we send in our voices to the advocates, our issues will be prioritized. Thank you.
Greetings to you all. I'm San Bakash, representing Youth in Advocacy and Governance. So my key takeaway from the ICASA Conference 2023 is that we as young people are a powerful tool in eradicating and ending AIDS by 2030 through meaningful and ethical participation, as well as leveraging on our communities, facilitating young people lead in their communities. All thanks to UNFPA and NAC for investing in young people's potentials to fight against HIV and AIDS.
Good day everyone, my name is Nashish Diako, Secretariat for the Young People's Network on Sexual Reproductive Health, HIV and AIDS. My key takeaway from the ICASA conference is that promoting meaningful youth engagement is crucial if we are to end AIDS by 2030. Thank you.
My name is Ayanda Jele, and I represent young people in tertiary institutions. My key takeaway from the ICASA 2023 is that we need to include pediatrics and adolescents in the fight for HIV so that no one is left behind.
My name is Abigail Miranzi, and I'm Secretariat
My key takeaway from the ICASA 2023 is that young people should always be ready with chairs to sit in decision-making tables and not wait to be put as names. Thank you.
My name is Ifitu Lemingwe, representative in youth in sports. My key takeaway here is you should raise, stand up, and know what you want and take actions against it.
Hi guys, my name is Blessing Natasha Ngwenya, district facilitator for Bulawayo North. I'm representing youth in sports. So my key takeaway for the ICASA is that as young people we have a voice, we have a decision to make, and we can fight against the spread of HIV and AIDS. And I'd love also to thank the ICASA team and the UNFPA for the support that they gave us as the young people.
Hello everyone, my name is Michelle Moyo from Mad South in Caesar District. I represent the youth in mining. My key takeaway is that as young people, we should raise our voice against sexual reproductive health and rights and HIV and STIs.
Good day, ladies and gentlemen. My name is Charles Matafin, Sector Representative for Youth in Arts. I'm grateful for the opportunity to attend ICASA 2023. Special thanks going out to UNFPA and National AIDS Council. It has been a wonderful experience being able to network and collaborate with other youth-serving departments and organizations. My key takeaway from this ICASA 2023 is the fact that it's high time young people are part and parcel of the proceedings at the table and not on the table, on the menu. Thank you.
Good morning, ladies and gentlemen. My name is Megda Sifanda from Machimoti, representing orphans and orphanages. My key takeaway, our young people's network, they have reduced HIV and AIDS and STI. I'd like to say to thank ICASA 2023 and UNFPA and National AIDS Council.
Hi guys, my name is Romania Tayengwa, District Facilitator from Mango District. I want to thank the UNFPA and NEP for their support for me to be here because of them. I'm representing youth in treatment care and support. My key message for ICASA, I would like to encourage young people to take part in decision making for their voices to be heard.
Hi everyone, my name is Kumsani Ngwenya, Provincial Facilitator for Bulawayo Metropolitan Province. My key takeaway from ICASA 2023 is a reflection from the President of ICASA and SAR, Honorable Pararenyatwa, where he reflected on 3 pillars of the conference, which is leadership, and science, and communities. So we are saying let communities lead in everything. Thank you.
My name is William Kondowe from Mashonaland West Provincial Facilitator. I want to give shout outs to UNFPA, National AIDS Council and organizers of ICASA for holding this conference and making us young people part of the conference, and we are really glad. My key takeaway from this ICASA 2023 were that young people need health services which are essential to them, which are non-judgmental and which are inclusive and which are confidential, so as to make sure that there is eradication of HIV and AIDS by the year 2030. Thank you.
Indeed, learning took place here at ICASA 2023 conference. Young people are impressive if you give them an opportunity to express themselves. Huge thank you to UNFPA Zimbabwe and the National AIDS Council of Zimbabwe. From me and the crew behind the scenes, other Young People's Network on Sexual Reproductive Health, HIV and AIDS members. See you next time.
Young People's Network on Sexual Reproductive Health, HIV and AIDS.
Promoting meaningful youth engagement in HIV response.
ICASA
2023.
Just one people, one vision, one mission. We can only end it as one people.